Let's compare functional dyspepsia and irritable bowel syndrome. Both of them are most common cause of chronic abdominal pain. Functional dyspepsia affects around 20% of world population, and irritable bowel syndrome affects around 11% of general population. It depends on location. In some places and some countries, it affects around 35% of population. So, if we take generally, functional dyspepsia is more common. Second and important difference is pain location. Pain in case of functional dyspepsia usually affects upper part of gastrointestinal tract. Upper part includes gastric or stomach, and first part, initial part of small intestine, such as duodenum. So, functional dyspepsia usually affects upper and causes upper abdominal pain and affects gastric and duodenum. While irritable bowel syndrome usually affects lower part of gastrointestinal tract, such as colon. It usually affects colon, large intestine, and it usually causes middle and lower abdominal pain. So pain location is important difference. In case of functional dyspepsia, we have upper abdominal or epigastric pain. In case of irritable bowel syndrome, we have middle or lower abdominal pain. Second most important difference is timing. Functional dyspepsia is related to postprandial discomfort or discomfort after eating, a feeling of fullness after eating. Person even eats normal size of meal, he or she can't finish it because he or she feels full. That's functional dyspepsia. So postprandial discomfort is functional dyspepsia. While if person's abdominal pain is correlated with defecation, it relieved by defecation, it's irritable bowel syndrome. So functional dyspepsia is associated with eating, and irritable bowel syndrome is associated with defecation or bowel movement. Another important difference is pain nature. In case of functional dyspepsia, we have burning or gnawing pain sensation and sensation of fullness in the stomach. So burning or gnawing sensation and sensation of fullness is functional dyspepsia. While irritable bowel syndrome characterized by crampy or colicky-like pain, and it relieved by bowel movements. So if crampy, if it's colicky-like, and relieved by defecation or bowel movement, it's irritable bowel syndrome. And causes. These two diseases actually look like each other too much. They are very like each other, but they are in different parts of the body. First part of gastrointestinal tract, here is functional dyspepsia, lower part is irritable bowel syndrome. And causes is abnormal stomach muscle activity, increased sensitivity to internal or visceral sensation. Also, functional dyspepsia can be associated with infections such as Helicobacter pylori, but most important words here is internal or visceral sensation increased, or increased sensitivity is important. And in case of irritable bowel syndrome, we have actually almost same. We have also abnormal gastrointestinal motility, we have increased visceral sensitivity and imbalance of microbiota. If in case of functional dyspepsia we have infection Helicobacter pylori, here we have imbalance in gut microbiota, imbalance between bacteria in our guts, and psychological stressors. Psychological stressors are important in case of functional dyspepsia also. And let's say about diagnosis, how we diagnose. We have no tests to diagnose functional dyspepsia or irritable bowel syndrome, because we should exclude other disease and we can make diagnosis after that. We should exclude other diagnoses. We should exclude other structural disorders. And a diagnostic criteria is bothersome postprandial fullness, early satiation, epigastric pain or burning, and no evidence of structural disease. So we have symptoms, we have epigastric pain or pain and burning of upper part of the abdomen, and epigastric pain, fullness, and burning sensation, but no evidence with structural disease. It's functional dyspepsia. While if we have recurrent abdominal pain related to defecation, associated with change in frequency of stool, or associated with a change or a change in form or appearance of stool, that's irritable bowel syndrome. So if it's associated with defecation, it's irritable bowel syndrome. If it's associated with eating, it's functional dyspepsia. And now let's say about treatment. Lifestyle modification is first in both cases. And in case of functional dyspepsia, we have proton pump inhibitors such as omeprazole as a first-line treatment. Second-line treatment is prokinetics or tricyclic antidepressants such as amitriptyline. And in case of irritable bowel syndrome, primary treatment is dietary modifications, regular exercise, and stress management, antispasmodics sometimes, laxatives if person has constipation, and antidiarrheals if person has diarrhea can be used as a second-line treatment. That's all I wanted to say. I think it's very important video because abdominal pain, most common causes of abdominal pain are functional dyspepsia and irritable bowel syndrome, and we should be able to differentiate between these two. We should know symptoms, causes, treatment. That's all. Thank you very much. Thank you for your interest. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.